Good afternoon, all. Welcome to today's talk. This is on the occasion of World Breastfeeding Week. This is an initiative which was initiated in 1992 onwards by the World Association of Breastfeeding, and it has been celebrated every year across the world by hospitals, nursing homes, and individual organizations to encourage and support breastfeeding and to encourage mothers and their families and the society at large to support a process which benefits not just the mother and baby but the entire nation as well. So, on the occasion of World Breastfeeding Week, let me share some pointers to you all, to my medical colleagues, as well as my dear friends, mothers, and all the people who support mothers and newborns to listen to some tips about nurturing every drop. What is something called breast milk bank, storage of breast milk, and smart usage of breast milk? Let us go ahead with the talk without further ado. I would like to share a presentation now. The PPT is coming up right now. Thank you. So my topic given is nurturing every drop, breast milk banking, safe storage, and smart usage. Every one of you, I think, knows very well the importance of breast milk, how it benefits the mother and baby, and so on. So today's talk is not just about the benefits of breast milk, but something beyond that. What is a breast milk bank? How to safely store express breast milk, and how to smartly use it so that you and your baby will benefit the best out of it. India's priority is breastfeeding. Why? Because in such a huge and vast country, which we still call a developing country, with a lot of people belonging to the middle and lower socio-economic group, the key to infant survival is breastfeeding. It is low cost and needs no extra equipment and so on, and it will help the baby to be saved from a number of infectious diseases. We all know the benefits of breast milk, like it contains so many natural nutrients essential for the growth and development of the baby. It contains natural antibodies to enhance the illness resistance. It is very easily digested. It prevents constipation and flatulence, that is stomach gas, in the baby. It lowers the risk of sudden infant death syndrome, that is SIDS. It leads to a higher IQ and higher intelligence during the early years of childhood. And there is no confirmed theory, however, for later developmental years. It reduces of the risk of babies being overweight and hence future chances of diabetes, obesity, and heart disease in the babies is prevented. It reduces the risk of breast cancer and ovarian cancer in the mothers and helps the mom to reduce the weight or lose the weight after childbirth. Also, its antifungal effect of breast milk is significantly superior to all other milks. So let me talk about human milk banking. We all know that a mother should breastfeed her baby exclusively for the first 6 months of life and so on. But what happens if this particular process or physiological phenomenon is interrupted or there are some challenges in it? This is where human milk bank comes in. A human milk has protective effect for normal and especially for the premature babies who are at risk of something called as necrotizing enterocolitis and sepsis. These are the two medical conditions associated with high rates of death, that is mortality in the newborns. What do milk banks do? The milk banks collect, screen, store, process, and distribute the human milk whenever needed. The strict quality control procedures are followed by milk banks to ensure the safety of donor milk while retaining many of the beneficial effects of the raw human milk. WHO and UNICEF state that the use of human milk from other sources should be the first alternative when it is not possible for the mother to breastfeed. Human milk banks should be made available in appropriate situations as far as possible. The IYCF, that is the Infant and Young Child Chapter, is actively concerned about the compelling use of formula feeds in infants because of the non availability of human breast milk banks. This is where we need to promote more and more growth of milk banks. There are, of course, some national guidelines for these human milk banks. These guidelines have been revised in 2017 and they provide guidance on establishing a milk bank, also called in technical terms as a comprehensive lactation management center. This is for the purpose of donor human milk collection, storage, processing, and dispensing for babies admitted in public health facilities, as well as providing lactational support to mothers at all delivery points. These CLMCs are established where? At tertiary public health facilities, that is, medical colleges and district hospitals, as well as now, thankfully, even in the private hospitals. And the assessment of all these is carried out by a state district quality assurance committee. Here we have to touch upon the problem of neonatal and infant mortality. We all know human milk continues to be the only milk which is tailor made for the human baby. All mothers should be encouraged to breastfeed their babies. If a mother is unable to feed her infant directly, her breast milk should be expressed and fed to the infant. If the mother's own milk is unavailable or insufficient, the next best option is pasteurized donor human milk, also called PDHM. The burden of low birth weight babies in hospitals across the country is nearly 20% of all live births. Feeding these babies with breast milk can significantly reduce the risk of infection and gastrointestinal problems like NEC in these babies. What is the history of human milk banks? The first human milk bank was founded in 1909 in Vienna, Austria. Wet nursing was in fact widely practiced across Europe during the 19th century in order to provide human milk for infants whose mothers were unable to provide milk for their babies. However, wet nurses were not always available, or when available, they pursued unhealthy lifestyles or carried infections that could be transmitted through their breast milk. An alternative to wet nursing was found in human milk banking. When was the birth of this HMB or Human Milk Bank in India? The first milk bank in Asia under the name of Sneha was founded by Dr. Armida Fernandez, an iconic neonatologist who started this in Dharavi, Mumbai on November 27, 1989. And it was run at the Civic Run Sion Hospital, also known as Lokmanya Tilak Hospital in Mumbai. Today, the Sion Hospital Milk Bank collects an average of nearly 3 to 4 liters of milk or more per day. Nearly 3,000 to 5,000 babies benefit from its services every year. Slowly, milk banks have grown across the country, and now there are more than 90 such milk banks across India. Growth of human milk banks, however, has been a bit slow as compared to the growth of NICUs. One of the reasons for this may be more formula marketing causing slower growth of these milk banks. But remember, why these milk banks are necessary? Because of the complications associated with formula feeding to the sick and very preterm tiny newborn babies. The mother's inability to breastfeed in the initial period has to be kept in mind, and hence there is a need to establish human milk banks in all level 2 and level 3 NICU facilities. Now, where exactly should the milk bank be located? A close proximity of the neonatal unit to the human milk bank is very much desirable. Better supervision by the medical staff will then be possible. Presence of human milk banks in the neonatal units is associated with elevated rates of exclusive breastfeeding rates in the very low birth weight babies. Postnatal wards or well baby clinics of large hospitals are most suited for the purpose, as donors are likely to be found in large numbers where medical and nursing staff can encourage them to donate milk. Who are the recipients of this donated human milk? top priority is usually given to the NICU babies, that is, the preterm babies and really sick newborn babies, which are there in the NICU for other reasons. Babies of mothers with postpartum illnesses. So the mother is in an ICU or really sick or ventilated and so on, and she cannot provide milk for her baby. Those babies also are eligible for this, receiving this donated human milk. Then babies whose mothers have lactation failure till their milk output improves may also classify for this or qualify for this. Then there are conditions like babies with short gut syndrome, that is intestinal issues, sepsis, and post-surgical gut healing. For example, conditions called omphalocele, gastroschisis, bowel obstruction, and intestinal fistulas. In this, the gut is still healing, and the baby has digestion issues, etc., and cannot definitely tolerate formula milk. Such babies will definitely benefit from the human milk from the milk bank. Also, it is possible to administer trophic feeds, which are given to gut prime the babies, that is, the early enteral feeds, to prime their intestine exclusively with human milk in the very low birth weight babies with banked human milk. There are some other recipients as well who qualify, like if the mother has no or insufficient lactation. For example, if she has multiple births, either twins or triplets and so on. Secondly, for adopted newborns, if induced lactation in a non-lactating female mother is not possible. Abandoned neonates or sick neonates. Temporary interruption of breastfeeding because of breast conditions or breast medical issues, surgical issues like a breast abscess, and so on. Infant at health risk from the breast milk of biological mother, which can happen in rare conditions. For example, the mother having some transmissible disease. And finally, babies whose mother died in the immediate postpartum period. All these babies can benefit from donated human milk. What are the processes in the human milk bank? All the donors undergo screening, recruitment. There is a donor consent which happens. The milk collection happens, transportation of the milk, then pasteurization, then a rigorous microbiological testing of the milk is done. It is stored, and then recipient prioritization is done and distribution of the milk is done. Which are the best places where the donor population is recruited? Hospital based, like mothers in the postnatal wards with excess breast milk, they can be recruited. Or an expressing mother who wants to continue to express to maintain her output, but her baby is not able to feed right now. For example, the baby is in NICU. Those mothers can donate. Then well baby clinic mothers having excess output. Then home-based donors or milk camps and collection vans, if available, can also collect the donated human milk. Most common practice is to pool human milk from multiple donors in order to ensure an even distribution of nutrients in the milk, such as proteins and fats. Requirements. What is the minimum requirement is for establishing a human milk bank, the infrastructure is a partitioned room of at least 250 square feet, which can comfortably lodge the equipment required for milk banking, a work area for the technicians, as well as storage space for records, administration, etc., and an area for counseling donors. Privacy is crucial for the area of breast milk expression. Provision of some music, television, or a creche for older child of the mother is very much essential to relieve her stress. Teaching videos of kangaroo mother care, expression of breast milk, and advantages of breast milk feeding can be shown under supervision of the milk bank staff. Few next slides you will find to be a bit technical and more for the medical colleagues, but it is interesting to note the amount of effort and technology and infrastructure which goes into the making of a human milk bank. The equipments needed are a pasteurizer or shaker water bath, a deep freezer, refrigerators, hot air oven or autoclave, breast milk pumps, which must be not just personal pumps but hospital grade pumps, then containers for the milk, and generator or uninterrupted power supply, because the milk has to be stored at a particular temperature for a long duration of time, and milk analyzers. So what does this pasteurizer do? It is essential to have a device to carry out the heat treatment of donor milk at a recommended temperature of 62.5 degrees Celsius for a period of 30 minutes. That is Pretoria Holder pasteurization method prior to its use. A well accepted alternative is the use of a shaker water bath with a microprocessor controlled temperature regulator, an electronic timer device, and a shaker speed controller. The milk in the container is boiled through the steam and hot water in the shaker bath. To avoid coagulation of the milk and to distribute the heat evenly, the tray on which the milk container is placed is shaken or wobbled. The shaker water bath should be double walled and made of steel. Its size, of course, varies according to the need of the milk bank, with a tray capacity from 9 to 24 containers of 200 to 400 ml capacity. Flash heat treatment, HTST, that is high temperature short time, 72 degrees Celsius for 16 seconds can be done, or ultraviolet radiation may be used. Going ahead for deep freezer. A deep freezer used to store the milk at minus 20 degrees Celsius, and it is essential in the milk bank. It is desirable to order a deep freezer with a digital display of temperature inside it with an alarm setting. It is desirable to have two deep freezers for the processed milk. First, for storage of milk till the post-pasteurization milk culture reports are available. The second deep freezer is used for storage of pasteurized milk once the culture reports are negative and the milk is considered safe for disbursement, that is distribution. The first freezer has to be locked at all times with access only to the technician so that no milk is accidentally used till the culture reports are come and they are negative. Moving ahead to the refrigerators, they are of course required to store the milk till the whole day's collection is over and the milk is ready to be mixed and cooled for further processing. It is also required for thawing the milk before being dispatched. Preferably, two different units should be used for these purposes. If not possible, then strictly earmarked areas should be kept in one unit. So an example of a refrigerator having different, shelves for different milks which are under different stages of processing. An hot air oven or autoclave in the milk bank or centralized sterile service department is essential for sterilizing the containers used for collection of donors, containers for pasteurization, and test tubes needed for the milk culture samples to the microbiology lab to send them in that. Breast milk pumps. Sorry. For milk banking, hospital grade electric pumps are preferred as they result in better volumes of express milks and are relatively painless and comfortable to use. There is no major difference in the types of electrical breast pumps. Manually operated breast milk pumps designed to operate more physiologically by simulating the infant's compressive action on the areola of the breast during breastfeeding can be used with lower cost implication. They can be reused with chemical disinfection or sterilization. Breast pumps can be a source of infection and hence they should be cleaned properly, which I'll touch upon later. Pump and its parts need to be sterilized, disinfected as per the manufacturer's instructions. Of course, we don't need to say, it goes without saying that a generator or an uninterrupted power supply is must. A dedicated centralized source of power supply and a backup to run the deep freezer and refrigerator in case of electricity failure is a must. Milk analyzer is desirable to have macronutrient analysis of the breast milk to estimate the calorie, protein, and fat of a milk sample using infrared spectroscopy technology in teaching hospitals as a step towards lacto engineering. This is a step forward and a very scientific advancement, I would say, in a human milk bank. Lots of staff are required, a panel of consultants to guide the overall functioning, from pediatric neonatology, lactation consultants, microbiologists, even OB/GY people, and the nutritionists. A director manages the entire functioning, a medical officer for the day-to-day working of the milk bank. Lactation nurses are there, milk bank technicians who oversee the pasteurization of the breast milk, and the microbiological surveillance. Then attendants for collection, sterilization of containers, and maintaining hygiene, and of course a receptionist for record keeping and public relations, as well as a microbiology department or a microbiologist for microbiological testing cultures of the milk to rule out infections in the milk, and infection control policies have to be in place properly. Now you will think, am I eligible as a donor? So, are you eligible as a donor? That depends. If your history and examination is normal, the doctor goes through your medical history, examines you completely, you're normal. There's no history of high risk habits like alcohol, tobacco, or drugs, no history of hepatitis or blood transfusions, not on any contraindicated medications like medications which cannot be taken during breastfeeding. The donor should be, of course, healthy, well nourished, no evidence of TB, that is tuberculosis, and of course, willing to donate out of own free will. All donors are screened for HIV, hepatitis B, VDRL, syphilis, hepatitis C, and all antenatal tests of that particular donor mother within the last 6 months of donation have to be within normal limits. So, yes, all healthy lactating mothers with healthy babies who are voluntarily willing to give their extra breast milk for other babies without compromising the nutritional needs of their own baby and willing to undergo the screening blood tests is very important to donate human milk. So the donors can include all mothers who are attending well baby clinics or whose babies are in NICU, or those who have sadly lost their babies but are willing to donate their milk, or lactating working staff of the hospital itself, or motivated mothers from the community. Donors are not paid for their donations. Try to reach maximum donor population using a variety of avenues. Spread awareness about possibility of breast milk donation in society by various means like mass communication, and that is what we want to achieve today, to encourage mothers across our society to donate human milk if possible. NGOs, social clubs, college students can play a good role in spreading this awareness and message throughout the society. Who cannot donate? Yes, some people may be disqualified as donors if they regularly take 2 ounces of alcohol or its equivalent or 3 caffeinated drinks per day. They have a positive blood test result for HIV, HTLV, hepatitis B or C or syphilis. If she herself or has a sexual partner suffering from HBV, HIV, HCV, or venereal diseases, or has a high risk behavior for contracting them in the last 12 months, has received organ or tissue transplant or any blood transfusion or blood product within the last 12 months, they cannot donate. Is taking any radioactive or other drugs, or has chemical environmental exposure or over the counter prescriptions. Megadoses of vitamins which are known to be toxic to newborn and excreted in breast milk, they cannot donate. Has mastitis or fungal infection of the nipple or areola of the breast, then they cannot donate. Or active herpes simplex or chickenpox, that is varicella zoster infections in the mammary, that is the breast, or the chest, that is thoracic region, they cannot donate. Collection of breast milk is done after a proper counseling, checking sustainability for the donation, sampling for the blood lab test is done. Then the donor is sent to the designated collection area where the breast milk is collected by trained staff with hygienic precautions. After the method of breast milk expression is chosen by the donor, if she wants to hand, that is manually, pump out her milk, she is allowed to do that, or the pumps are offered to her. Home collection of breast milk may be better avoided, especially in uneducated population due to risk of contamination. So it can be done in specific designated collection areas. How to collect? Wash the breast with water before expression, and as good as washing with so just washing with soap and water, normal routine bath is enough. Never discard the foremilk, even though it looks watery to your eyes. Please keep the foremilk as well. The breast milk may be expressed manually or with breast pumps. Manual is low cost and effective and with less risk of contamination. Simultaneously, breast milk expression in both the breasts is more efficacious than one after the other breast. Milk should be collected in properly labeled sterile container and transported to the milk bank under cold storage condition. Drip milk, that is the milk which drips from the opposite or non-feeding breast in some of the lactating mothers, collected with the help of breast milk shells, has been found to be nutritionally inferior with lower fat content, and it is not recommended for banking. Which containers for the express breast milk are to be used? For collection and storing the milk, single use hard plastic containers of polycarbonates, Pyrex, or propylene are used across the world. However, in Indian experience, cylindrical, wide mouth, stainless steel containers of about 200 ml capacity with tight fitting screwed caps are equally effective. They are easily available and are durable, easy to clean, and autoclave. There is no significant decrease in nutrient composition on storage. However, the cellular components are definitely reduced. As you can see, the cells in Pyrex containers, they stick to the glass. Polypropylene, they maintain phagocytosis, and in polyethylene bags and polyethylene rigid, there is no effect. Fat soluble vitamins, no effect. Micronutrients, no effect. Secretory IgA, not in Pyrex or polypropylene, lower in polyethylene bags, and stable in the polyethylene rigid, bottle, and which are difficult to handle. The bags are, of course, very easy to spill out. Otherwise, the rigid polyethylene is okay. Pyrex is recommended for milk, and polyethylene rigid is also recommended for milk. Each container must carry the name, date, and time of expression. The milk remains in the freezer until it is delivered to the bank, and the milk is transported to the milk bank either by the mother herself or by a transport service provided by the milk bank. So, it is important that the cooling chain throughout this transport process is never interrupted. Therefore, special cooling bags or cooling boxes have to be used during the transportation from home or the collection center to the milk bank. Milk donation is an act of unselfishness. In most countries, donors receive no compensation, but in some countries, donors receive modest monetary compensation for actual costs incurred. It represents mostly just a token of appreciation, and it is not a commercial process at all. Processing. All batches of collected raw breast milk should be refrigerated immediately till the serological report comes negative. The fresh raw milk should not be added to frozen milk. Remember this for expressing at home also. Fresh raw milk should not be added to frozen milk, since this can result in defreezing with hydrolysis of triglycerides which are present in the breast milk. While mixing the fresh raw breast milk to frozen raw breast milk previously collected from same donor, it should be chilled before adding to the frozen milk. For sick or preterm babies, it is advisable to use a new container for each pumping. Before pasteurization, pooling and mixing may be carried out from multiple donors to ease the process of processing and storage. The microbiological screening means a culture report for germs of the donor milk is done before, if there is no cost constraint, and as soon as possible after pasteurization also. So, two times the culture is tested. Pre-pasteurization microbiology can result in wastage of milk up to 30% in some cases. Even after pasteurization, the endotoxins of some organisms are still present in milk, but they have not found to be having any clinical effect on the baby at all. A bacterial count of 10 raised to 5 colony forming units per ml or more in raw breast milk can be considered as an indicator of poor quality of milk, and that has to be discarded, not used. No growth is acceptable in post pasteurization microbiology cultures. Whole batch of culture positive container of pasteurized milk should be discarded. That entire batch is discarded, not just one bottle. Now, to store. The pasteurized milk awaiting culture report should be kept in a dedicated freezer or freezer area, taking precaution not to dispense it till the culture comes negative, obviously. Storage should be done in the same container that is used for pasteurization. It is advisable not to transfer the processed milk in other containers as it has a risk of contamination. Culture the negative processed milk should be kept at minus 20 degrees Celsius in tightly sealed container with clear mention of the expiry date and other relevant data on the label. It can be preserved for nearly 3 to 6 months. Random cultures of the preserved milk before dispensing can aid quality assurance. That means intermittently surveillance of this stored milk is done. Milk distribution. PDHM should be dispersed at the physician's requisition from NICU physician after informed consent from the parents of the recipient. Preterm baby should preferably get the PDHM from the preterm donors themselves. It should be done on first in, first out basis from the storage. That means initially collected breast milk has to be used initially, and sequentially, date wise, you can continue to use the breast milk bottles. Transport of the PDHM, that is pasteurized donor human milk, should be done under cold storage in the same pasteurized container till its use. Frozen PDHM should be thawed by either defrosting the milk rapidly in a water bath at a temperature not exceeding 37 degrees Celsius or under running lukewarm water. It should never be thawed in the microwave, remember, because this results in reduction in the IgA content of the milk, and there is a risk of burns if the milk is used too soon. That is, the baby's tongue, mouth, oral mucosa can get burnt. Now remember, these are some things or tips which can be remembered even by the mothers when using the breast milk at home after, freezing, thawing, and so on. Milk should not be refrozen after being thawed, as this increases the hydrolysis of the triglycerides in the milk. Use within 24 hours of thawing. While bringing to room temperature, it should be gently agitated to make a homogeneous mixture before use. Otherwise, while you thaw the breast milk which is frozen, what happens is there are some particles and other things which keep floating in the milk. So, continuously, very gently in a uniform way, shake the milk or agitate the milk so as to keep it uniform or homogeneous. It should be used preferably within 2 to 3 hours to prevent contamination. This pasteurized donor human milk shelf life is 6 months from the date of collection. Composition of donor milk. There are some myths around donor milk. Many people say its quality is reduced, it may be contaminated, it may have infections, and so on. But partly, though it is true, still donor human milk is the second best option after mother's own milk. Remember that. Pooling of milk from multiple donors is performed so that the protein fat content is stable. That is one thing. Low variability is of particular advantage in the case of preterm babies because variable protein content is often the source of concern about very, very high intake of protein. That is also not required for the preterms. So, pooling the milk from many donors together, causes the mixing and a more uniform protein level to go to the preterm baby. Low variability of composition also has advantage that the infant's nutrient intake varies little from feeding to feeding, and it is essentially always known. On the other hand, some important protective components like oligosaccharides are essentially resistant to the effects of heat. Given these effects of high temperature processing, it's expected that protective effects of human milk might be diminished slightly, but definitely not abolished altogether. Comparing formula with donor milk with regard to the incidence of NEC, risk of NEC is considerably diminished with each trial of donor milk. So, collectively, it is shown that a significant protective effect of donor milk is definitely there if you compare it to formula. If you slightly look at this particular table, it will show the effect of pasteurization on the milk components. That means, does the donor milk have all the components of the breast milk intact or no? So some of the immune components retention is 0, like C3 becomes 0. But IgA may be 0 to 150%, IgG 82% may be retained, IgM also, nothing is retained, but lactoferrin, lysozyme, all these immune components may get retained. Cellular components like leukocytes, that is white blood cells, the number is decreased, but hardly functional ones are seen. Lymphocyte also number is decreased, but no functional ones are seen. Enzymes like alpha 1 antitrypsin, 61% is retained. Lipoprotein lipase, it is completely destroyed. Bile salt stimulated lipase, destroyed. Esterase and all is destroyed. TGF alpha, however, 93% retained. TGF beta, 99%. Whey casein ratio is decreased relative to the original human milk. However, nutrients like fatty acids, vitamin A, folic acid, B1, B2, niacin, biotin, vitamin C, D, E are quite a lot retained. So, definitely, there are multiple advantages of donor milk as respect to the nutrients it gets retained, though definitely it's slightly lower in quality as compared to the mother's own milk, that is the fresh, express breast milk or direct breast milk. Finally, labeling and record keeping obviously is very important. The milk bank should have a operational objective of ensuring full traceability of the individual donation to recipient. Maintaining a record of all storage and processing conditions has to be done. Written SOPs have to be followed. Confidentiality of records have to be maintained by the milk bank. Labeling, as can be just seen in this picture, has to be mandatory at all levels. The sterile container for collection of donation, pooling vessel, pasteurization container, storage container, everything. Labels should be water resistant. Name of milk bank, names and identifying details of donors, date of pasteurization, batch number, expiry date, everything should be clearly legible. Record keeping, very much must. It has to be there at all levels, and meticulous for donor record file containing consent form, donor and her child's data, screening reports of the donor pasteurization batch files, and a dispensing record file containing relevant data and the recipient consent form as well. Beyond 5 years, usually the data is not mentioned except where milk kinship issue is of paramount importance. So overall, this is what we see: selection of the donor mother, health check of the donor mother. She expresses her milk is stored in home or the fridge. Then milk is transported to milk bank, stored in the bank freezer, thawed and pooled. Milk is aliquoted, it's pasteurized, cultured, at random, or pre and post pasteurization, it's cultured, and then it's delivered to recipients. Do milk banks benefit society? Definitely, there is no doubt about that. Cost effectiveness of using the banked human milk in NICUs is largely due to the reduction in the rate of sepsis as well as NEC in the newborn in the NICU, and of course versus the cost of maintaining a milk bank. All the personnel required, the expertise, the infrastructure, machines are required for the milk bank, that has to be weighed. But definitely the benefits to the newborns definitely outweigh, I would say, because the newborns are definitely the future of the country. Given the high incidence of sepsis and large burden of premature births, this intervention, that is having a milk bank, may have the potential to result in substantial saving for our nation. What is the option if there is no milk bank in the hospital? If mom, what is mom? Mother's own milk. If mother's own milk is not available, and if there is no milk bank also in your hospital, then recently many hospitals have started using pasteurized human breast milk, which is commercially now available. Many preterms have benefited from its use. In fact, thousands of newborns have benefited from its use. And then we can, claim to sustain an exclusive human milk diet for these babies. That means still they can go on their mother's own milk. These babies will still get human milk. Even human milk fortifiers are now available, and they can be used as breast milk fortification systems. It's clear that artificial formula will never provide the broad range of benefits of human milk. Given the high rate of preterm births in country, malnutrition which ensues in the postnatal period, there is urgent need to establish milk banks across the country, especially wherever large neonatal units are there in hospitals. yes, I do recommend that milk banks are a must. Going to the last two small parts of my lecture, that is, I want to tell a few tips and guidelines about human milk storage. That is, when you express your breast milk for your baby for some reason, either the mother is sick or some medical condition in the mother, or the mother and baby are separated, for example, mother being in ICU, or the baby is in an ICU and cannot take oral feeds, for example, the baby is too sick or on ventilator or is too premature to have a mature suck and swallow cycle, then tube feeds are given to such babies. So the milk has to be expressed and stored by the mother. Or at home also, if there is extra or excess milk supply, a lactating mother can express and store her breast milk. So what are the storage guidelines? So freshly expressed or pump milk can be stored at room temperature up to 4 hours. This is also randomly called as a 4-4-4 rule. So room temperature up to 4 hours. In the refrigerator, freshly expressed milk remains good for up to 4 days. And in the freezer, minus 18 degrees Celsius or cooler, it can remain up to 4 to 6 months best. Up to 12 months sometimes may be acceptable. Now, thawed or previously frozen milk, you can store at room temperature only 1 or 2 hours. And in the refrigerator, only up to 24 hours. That is thawed after being previously frozen. And never refreeze human milk after it has been thawed once. Okay. Then leftover from a feeding, that is the baby did not finish from the bottle, then what do I do? Or you have expressed the milk and you were giving with a vati spoon feed, the baby has not finished the milk, what will the mother do? Then use within 2 hours after the baby has finished feeding, definitely. So these guidelines are always there for healthy full-term babies and may vary for premature or sick babies. So the doctor and neonatologist will be deciding for the baby according to the particular medical condition. Why all this? Why milk banking? Why expression of milk? Why storage of milk? Because yes, breast milk is liquid gold. Why liquid gold? Why bank the milk? We bank something which is precious, right? So yes, it's a liquid gold because there are stem cells, immune cells, water, proteins, carbohydrates, fats, vitamins, minerals, and antibodies all bundled up in one, excellent nutrition for the newborn baby. The basic principles of expressing and handling milk are all unanimously same, uniform, like practice meticulous hand hygiene, use only clean food grade, that is glass or BPA free hard plastic containers, clearly label all containers with the date and baby's name. This holds true not only for the milk bank but also when you express milk and store in your homes. Tips for safely thawing the frozen breast milk. So defrost the oldest bottle of breast milk first. So first in, first out, right? Secondly, do not thaw breast milk at room temperature. Place it in the refrigerator or in a bowl of warm water. So don't just keep the frozen milk at room temperature. Remember, either keep it in the normal part of the fridge so that it slowly thaws, or you can keep it in a bowl of warm water. Never microwave. Never place it in a pot of boiling water. That will all destroy the good stuff in the milk. Once defrosted, warm up the breast milk and to room temperature or slightly warmer and use immediately. Dedicated breast milk storage bags are available, or hard plastic or glass containers with tight lids can be used. Avoid disposable bottle liners or household use plastic bags completely. Store in a clean, cool location away from sunlight when storing at room temperature. Store milk in the back of the refrigerator and not in the doors of the refrigerator. Fill the container when you are expressing and storing. Fill container only 3/4. Do you know why? Because when the breast milk gets frozen, it will expand. Okay, otherwise the bottle may crack or the bag may just burst open and your liquid gold will go waste. Some breast pumping tips for new mothers: use the right breast pump. Use the pump correctly. Learn it from a lactation consultant, lactation nurse, the pediatrician, doctor, RMO, whoever is there to help you. Make sure that the flange, that is the funnel shaped thing of the breast pump, fits perfectly on your breast. Sit in an extremely comfortable position. Prepare a snack or drink, while eating you can pump, okay, or while doing small writing stuff you can pump, and apply warm moist heat to the breasts before pumping. Morning times is the best time for a lot of milk production. So pumping at that time, but is best, of course. But pump regularly is very important. 3 to 4 hourly breast pumping is very important to maintain a good supply of breast milk. One thing which we fail to reinforce is that you cannot keep on using the same breast pump forever. Some of the pump parts have to be replaced, like there is a valve which has to be replaced in every 1 or 3 months. Then there are another small parts of the pump which can be replaced in 2 to 8 weeks, the flange 3 to 6 months, then the breast shield 6 months, and so on. So follow the manufacturer recommendations which will be given in the instruction pamphlets along with the breast pump. This we have already done. So remember, when you thaw or unfreeze breast milk, do refrigerate 12 hours to thaw, to be consumed in 1 day. Thaw in a bottle warmer, thaw in a hot water bath, and swirl before the baby's use. Do not microwave, do not heat, do not refreeze, do not add fresh milk to thawed milk, and do not shake too vigorously at all. This we have already done. I'm not going through this. Safe transport, you can use insulated coolers like shown on the right side. It's a cooling bag with frozen ice packs, and it's good for up to 24 hours during traveling with the baby. Place the ice packs in constant contact with the container of the breast milk. And portioning and preventing wastage of the precious milk. Store breast milk in small volumes so that you don't have to throw away the remaining part which the baby doesn't drink. Adjust the portions based on the feeding needs of your own baby. Use smaller increments for premature or sick babies, that is meant for the doctors to follow in the NICU. And of course, your routine pump care, washing hands thoroughly before and after pumping, sterilizing all the pumping parts and containers, and keeping a log of your own pumping sessions and quantities is a must. I will conclude by using this quote: a newborn baby has only 3 demands. They are warmth in the arms of its mother, food from her breasts, and security in the knowledge of her presence. Breastfeeding satisfies all three. Thank you so much. I hope this helped a lot of new mothers and people who will be helping these new mothers and their newborn babies. Thank you.